All right. Okay, so let's get going. Next slide. So just as an overview of MNT, it's a 12-week full-time course. The first 2 weeks are spent at the USC clinic. So this is new. Last year, we've been always trying to get students to have more experience in a private practice setting, and we've had our clinic there, and over the years, students had various times in the clinic. But last year they all got 1 week in the clinic, but it was at various stages throughout their placement program. So you would have had students arriving to you who hadn't spoken to clients before, which was fairly normal. That's the way it had always run before. Whereas this week we've actually put it at start before they arrive on placement. It doesn't mean that it's directly adjacent to them starting. So it doesn't mean that in week 1 and week 2 they've gone to the clinic and then directly in week 3 they've gone to a placement. With some of them that will be the case, but some of them might have a bit of a gap after that 2-week time at the placement. But we found that's a really great way for them to just get some basic skills communicating with clients and some basic a bit of confidence in at least delivering a diet history and doing some initial education, simple educations with people. So, but that means in the feedback forms, the first 2 weeks are actually the clinic. So when they arrive for their first placement at a site, that would be week 3 in the book. So there's been a bit of confusion about that. So the other thing about the USC program, and I noticed Linda, I think, said there were some supervisors who hadn't had USC students before, or I'm not sure if it was Linda or Bonnie. But in the USC program, we don't have set milestones for weeks. So by week 2, they don't have to have achieved competence in something, and then by week 5 in something else. We recognise learning as taking place at different stages for students. Some people work in a nice linear fashion, some go forwards, backwards, and some are definitely thrown by going to a new placement site, different supervisors, etc. So we don't assess their competence until they've had their full 12 weeks on placement. Now I've written in there plus or minus 2 weeks. If a student's assessed as not being competent at the end of their 12 weeks, at USC we do offer another 10 days placement. And we'll do that generally in the clinic where they'll have a really good ratio of student to supervisor time, because the supervisor there doesn't have to manage a workload apart from the clinic, which the student's involved with. Then, so at the USC clinic, they do diet histories, simple educations, practice time management, counselling skills and documentation. Now in the 12 weeks, there's a weekly feedback process, which includes forms, and we'll talk later about the student-led approach. So to maximise the learning potential of a feedback opportunity, we ask students to provide their thoughts first and actually prepare for it and write them down. Every week there are also USC student tutorials. They're held on Fridays from 3 till 4 p.m. via Zoom. So we do ask that supervisors try to have the students there on time, because it's a really beneficial learning time where they can debrief and also share their learnings. Every fortnight, this year we have fortnightly phone calls. Last year it was every week, but that wasn't quite necessary for some of the students who were progressing well. So what we've made it now is a fortnightly phone call. Now at the phone call, I speak with the supervisor first, so I know what's going on. And then I can weave that into my discussion with the student who I speak to directly afterwards. So that's to provide support to the supervisor, sorry, and the student. And the feedback was that they were very useful those times.
Tanya, sorry, could we jump in with a quick question?
Yeah, sure.
Hi, this is Naomi. I have a student as I'm a secondary supervisor, so they're with another supervisor Monday to Wednesday, and I'm going to have them on a Thursday and Friday.
Mm-hmm.
Those fortnightly phone calls, would that be on a particular day, or like on a Friday, or is it going to try and be with the primary supervisor?
Yeah, so what I do is I have set times in the week that students can book interview sessions, and it works around my other, sorry, I've got a frog in my throat. it works around my other sort of duties in my role. So this year it's Wednesday mornings, Thursday afternoons, and Friday mornings until lunchtime. So there are 3 different days of the week there to try to work in with supervisors. When a student has a primary and a secondary, it may just be that it has to be on a certain day because of those times available. But the assumption is, and what I've found is, whenever there's a primary and a secondary supervisor, people do tend to collaborate and just check in with the other one. They both tend to know where the student's at. You could also vary it, that one time I speak with one supervisor and one time I speak with the next, because there's only about 2 catch-up calls in a 5-week period anyway. So you're more than welcome to do that.
Okay, great, that makes sense. Thank you.
Okay, yeah, look, appreciate your question. Good question. Throughout the 12 weeks, we also like if students can present a group education. Now, these days, a lot of hospital dietitians aren't doing group educations. So we understand if students can't do this over their 10 weeks of external placement. But if there is an in-service that some of the nurses have been asking you on the wards for, or if there's been something legally on your mind that you've been thinking, oh, if I had time, I'd like to do that, or maybe there's something for food service staff or allied health staff, if there is a group education that you think the students could do to help you and to also help them, please, let them arrange it, let them prepare it. That's all within what they can do with their time with you, and it's a valuable learning experience. I just put up there that Townsville Hospital have as part of their program that the students deliver a journal article, and that becomes their small group education. And I think that's a really clever way of getting students to contribute to the education of the department and also increase their skills. So I just threw that up there as an idea. Over the 10 weeks, there's also 2 case study presentations that students deliver. So one would be in the first 5 weeks, and then they would present one in their second 5 weeks. We also hope that they do 5 SGAs or PGSGAs over the entirety of their placement. But the request is that it must include a physical assessment, so that at least we know students are not afraid of doing a physical assessment and talking the patients through. We like them to have been able to be involved with one enteral feed at least, where the student calculates the requirements, documents it, and follows through. So that's just something to be aware of, particularly if they're on their second placement and they haven't done an enteral feed. And that might be a time when the student raises that with the clinical educator, and perhaps there's some way you can work out with the team that they get at least one experience with that, because we have in the past had students graduate who haven't done any enteral feeds, and they go to a place, they get a locum or something, and they can't do an enteral feed, and it's a bit awkward for them. So we just hope that they get at least one practical enteral feed. We also want them to remember about the science behind dietetics, which sometimes can be sort of in the back burner when you're racing around the wards or doing something. So we do expect them to do one nutritional analysis using FoodWorks of a diet history. Then they have an e-portfolio that we call PebblePad. That's just the platform. They have to do weekly tasks and progressive tasks, and I'll talk about them all later. And their grades are notified at the end of semester, the formal grades. So just to recap the placement site resources. So we send out at the start of the year, and please let me know if you haven't received a copy of these, or talk to your clinical educators if you haven't, because positions change over the year, and perhaps you're supervising a student and you didn't receive these. So there's a medical nutrition therapy placement site guide, which provides a comprehensive overview of the program. There's a peer-assisted learning guide. So some placement sites utilise it for the whole of the placement, some use it for part of it, where they use a peer-assisted learning approach, or a 2 students to 1 supervisor approach. So we have a guide for that, which includes feedback forms to use. Then there's a digital copy of the student workbook. So the student workbook contains hard copies of the feedback forms, and we send supervisors a copy of that so you can look it up at any time to see what's coming up in any week. But also some people really prefer typing their feedback, so you can do that then. Otherwise, you could write it by hand on the student's copy. So just so that you're aware of the students' resources that they should all have their handbook of nutrition and dietetics. They should have the NCPT guide to help them with PESs. A dietetic text, we had 2 that they needed. We had the option of 2, so they should have 1 of those. They should have a suite of pro formas that various students have developed over time. So one for community, one for pediatrics, one for in-hospital placements that they can play around with to help them ask the right questions. There are lots of documentation guides. There's a starting list of common medications that they're meant to build on. There is a small biochem and medications tute. It's not as comprehensive as the Queensland Clinical Educators Group one though. So if you have that available and you're happy to put that in with your tutes for students, that'd be great. They get colour photos that can complement the SGA forms. They have the Queensland Health Electrolyte Guide, which I think is really helpful when they're making considerations regarding refeeding issues. There's a clinical reasoning tool there, just a home developed one. There's a guide to using FoodWorks. There's a guide to case studies. They all have access to FoodWorks on their own devices. They have their Managing Wellbeing on Placement tutorial because medical nutrition therapy can make students anxious. So we've built this into our pre-placement curriculum so that there's the tutorial and then there's a building resilience workbook. And then we've also put in their resources, the ATSI patient care guidelines, which we find really helpful and we ask them all to complete. Any questions so far? No, I'll keep going in. All right, so now that's their 4th year resources. We did have a request from the sites to know what they actually study in 3rd year. So in a real nutshell, I've put those things together because I'm sure you'll appreciate we can't teach them everything. And from when I went through 30 years ago, the level of complexity and speciality for diseases has just grown, as has the number of medications, as has the number of tests. So really they get basics in some basic conditions that they have to then learn to apply to novel situations. So in 3rd year, they do cover nutrition support, liver, inflammatory bowel disease, trauma and critical care, pulmonary diseases, oncology, renal, overweight and obesity, cardiovascular disease, type 1 and 2 diabetes, aged care, malnutrition, GI and diverticular disease, allergies and intolerances, and basic peds. So I'm sure you'll be thinking, oh, you know, there's some things there that we'd love them to have, but it is a full curriculum. We do the best they can, but if students say I've never seen it before, they may not have, but it's up to them to go and find out about it, of course. In terms of dietetic skills in 3rd year, they had, last year's cohort was really fortunate. We totally rejigged our counselling course and also another course that we had at the end for dietetic skills. So we could include we think we could enhance their program. So it included topics such as communicating with difficult clients, student-supervisor relationships, how to receive and process feedback, how to read medical charts, common abbreviations, working in a multidisciplinary team, chart writing and clinical handover using Isobar. So hopefully that will translate to when you get students starting out. We're hoping that they'll be a bit better prepared. So their e-portfolio, so students are required to do work that's submitted each week. So they do keep quite comprehensive de-identified statistics for us, and they need to include in those statistics patients that they've observed a supervisor or another student with, because that becomes part of their rich learning experience. Observation is a learning opportunity. We get them to write down what the main medical conditions are of the patient and then what the nutritional intervention was. And we do that because sometimes students come back and say, oh, all I did was HE, HP. And it's like we can bring them back and say, well, what medical conditions did the patient have and what process? You know, it highlights to them that they were actually getting a broader experience the fact that it ended up as HPHE is neither here nor there, because they've had to filter and do clinical reasoning along the way. We also get them to put in there how long they spent with the client, or how long their supervisor did, so that they're already thinking of time and that they can see over the 10 weeks or 12 weeks how they've improved with their time management. Please ask them to show you what they are recording. It might be interesting for you. Then every week they need to do a guided reflection. So it's not just a blur of what happened in the week. It's about an incident or their overall thoughts, and there are topics that they have to cover, which is how it meets the criteria of a guided reflection. Based on that reflection, we want them to do weekly SMART goals. So to really flesh out their learning goals in there. And once again, there's headings in there that they have to respond to the S and the M and the A and the R and the T, and they have to do that for 3 goals. So they build on the feedback that they get with their supervisor. At the end of the forms, we'll get to it later, but there's 3 goals they talk about with their supervisor. Then they're meant to take them away and really develop them. Then there's weekly feedback forms. Now notice it's the word feedback, they're not assessment forms. So it's an opportunity to have the discussion and to guide their learning process. They need to write down practical time efficient diet disease relationship explanations for 4 conditions, just as a sign that, because in 3rd year they have to do diet disease relationship explanations, which can be pages long because they're learning the process of what needs to be in there. But this is more like on the job, what do people do? They have to develop their own medications and biochem cheat sheets, because we find they don't tend to look in their little books. I don't know how they expect to learn, but so we've sort of had to put some of these things in as forcing functions. The analysis of one diet in FoodWorks, and anything that they've developed for themselves or the department. So I just want to just raise learning and teaching as a topic, just to remind us that we all have our preferred learning styles. And I've got the link in here about the learning style questionnaire. So VARK, visual, auditory, reading and writing, and kinesthetic. If you've never heard of this tool or preferred learning styles, I think it's a really great thing to do. It doesn't take long. And at the end of it, it will help explain how you can help your own learning, or let's say a student's learning, or even understand it, how we're all different. So with a preferred learning style, we have biases. So we tend to teach the way we like to learn. So I know some supervisors just want to throw the students in at the deep end because that's what worked for them. Whereas some students, that won't work at all. It will terrify them and they'll go backwards. They need to understand it a bit more, observe a bit more. So some students you'll find, hang on, I just have to write down what you're saying. And even though you may not understand that, it's best if you just let them, because that's probably reflecting how they learn. Once it's written down, it can actually start to sink in. It's like my husband, he's very auditory, and if he tells me something or tries to teach me something just by talking, it's pointless. I have to say to him, no, you know, I need to write it down. So he can't teach me really anything, unfortunately, very, very well. I'm more of a reader-writer, and I have to write it down. So it's good just to remember that we have our biases. Students learn best by hearing, some learn best by doing, and some by watching. So it's just trying to have an understanding of our biases, and that there can be a mismatch of your preferred teaching style and their preferred learning style. So I think the lesson there is to just try to accept that there can be differences, and that it's not your job to get them to progress as fast as you want them to. That basically they have to kind of lead their own learning pace, because there's no point trying to speed them up and teach them your way if it's not going to work. So it's also, under learning and teaching, there's a recognition about stage learning. So it's much more important that students learn to master the introduction, the gathering information, introduction, and diet history before they focus on the diet disease explanation and implementing something. Because if they progress too fast, it's very hard to unpick what they've missed. It's also good to remember about introverts who need time to formulate answers or reflect. So that comes in a bit later after you've observed them. If you do the typical thing that we've always done is, how do you feel that went? Well, introverts may not be able to respond meaningfully at that moment. Extroverts may talk and you'll think this is totally unrelated, but by the end of when they've been talking, they're actually making sense. And that's because by the actual method of talking, they're coming to think things through. So you might have some friends like that, or people you know like that. You just have to let them talk. Forget about what they said at the start and just hone in on what they said at the end, because they've actually been working out what they're thinking by talking. Some students do find it very hard to reflect, and that's why on their ePortfolio Pebble Pad we have a guide for reflection. But you might also find that that is a bit tricky if students find it hard to reflect. Are there any questions or comments at this stage?
Yeah, Tanya, can we just check, do you request that all the students complete the VARC questionnaire before they come to placement, or is that something that you encourage the sites to do with the student?
I think they've done it in their undergraduate. I'm not sure whether we covered it in third year. I can't say categorically whether we actually got them. I can't remember. Last year was a bit crazy with COVID.
So it might be worth us just asking when they come on placement if they've done it yet, and if they haven't, potentially get them to sit down and do it, as well as the supervisors doing it as well.
Yep, and I'm just about to email the new beginners for second semester, so I'll put that in there with their ATSE guidelines and a few other things. Thanks for that. Anyone else? I'll keep going then. So this slide's about observation and teaching. So I had a discussion with your clinical placement coordinator. It was Rhiannon Barnes, and yes, she's back again, about student observation, because what we tended to find was that as students progressed in their placement, the opportunity to observe their supervisors dropped off. And I think there's a legacy from the past where there was an expectation that towards the end of their placement, students should be managing a workload almost independently. So with that came the time pressures of managing a workload. So observing a supervisor kind of wouldn't fit in. So I had a discussion with Rhiannon, because essentially students, what they pick up in their first 2 weeks, if that's the only time they get to observe, would be totally different to what they pick up in the end. So they'll be looking at much higher level complex things later on in their training, which is really vital, because that's the last time they'll ever see another dietitian. It also helps affirm what they're doing or helps them self-correct. So there is an expectation that a student can observe a supervisor at minimum twice a week. Now, supervisors can say that that might be a bit demanding on them in terms of their workloads. So there are some methods that can help you with that. You could use the observational only technique, which is where you set ground rules in advance to say, okay, I want to let you see me at work, but I'm not going to be explaining what I'm doing. I just want you to watch me, follow me, pick up what you pick up. What you don't pick up is fine. So the student just follows and observes you as you're doing your role. There's no discussion. So the benefits of that include assisting time poor supervisors, and also students seeing supervisors work in real time. So in terms of their time management skills, they're getting a really good framework of how fast you can work. You can allow the students to read the notes afterwards to make more sense of it if you like. So that is something that some of you may not have heard of, but is particularly useful. That also fits into the teaching on the run method, which is a method used with medical students and for more technical tasks. I talk about that at the bottom of the slide, where the supervisor undertakes the task in real time with no discussion. Then the supervisor talks through what they've done and shows what they've done. And then the student talks through and shows what they've done. So it links into a couple of learning methods. So please allow yourself to take that on if that will help you. So then it comes to supervising students. So we hope that students would be observed at least twice a week as well. I've got the topic there, teaching, because when we rolled out the peer-assisted learning, what we found was that there was a perception that that two students could teach each other really well. With adult learning principles, they should be able to teach themselves, and the supervisors could step back. And I think what that lost was the role of actually teaching. Students do need supervisors to teach a bit, because they're not efficient if they're learning by themselves. You might have experienced having had a student in their first week and they take hours and hours looking at a medical chart, working out what to find. Well, that's just a waste of time. Really, if you can guide them in how to read a medical chart efficiently, that will save them a lot of time and teach them techniques much faster. Most people do this, the second point, by nature, but that's talking through what you're doing, talking out loud when you're gathering information from the chart. You know, can be just quiet, a little bit aside from where the patients are, of course, but if you can talk them through about your thoughts before you see the patient and afterwards, which is modelling for them what you want them to do for you when they start to get more independence, which is to tell you what they've found out, what their thoughts are, and the processes. So you're modelling how they are to work with you. Any comments there? Oh. Okay, so let's have a think about student progression, and I've put up that that graph there just to try to challenge our way of thinking that, which is quite persistent in dietetics, that we want to try and challenge. And that is that students progress in a linear, nice line fashion. They don't. You know, I'll even have students say on Friday tutorials, I feel like I just stagnated this week. And you as a supervisor might feel the same. It's like they just haven't progressed at all this week. But that's quite normal. We're not computers. And sometimes they've have to hear a thing a few times before it sinks in, or before they've worked out a way to improve it. And that's like feedback in general. I mean, if we're given feedback, let's say about me, might be that I too much. For me to change how often I from this session with you to a session tomorrow, it's very likely that I can stop umming. I think we forget that it actually takes time to retrain the way we do things automatically. And there can be a perception amongst supervisors. I've told them once they should know, but just reflect if you've had children or back to school days, how often you had to repeat things to learn something new. So because of that, we don't have set milestones for the weeks. That also makes it a lot easier for students and can take some stress off, because we have to consider different caseloads, different contexts, different supervisors. Their whole work paradigm can be totally different from one week to the next, and there needs to be acceptance of some adjustment within that, as well as they're not even competent yet. So having said that, weeks 1 to 2, they're at the clinic, they're starting to gather info, take diet histories and do some simple interventions. Week 3, which is the week 1 in the new site, we really are looking at them gathering information and observing supervisors. If you're happy to let them step up to take diet histories, that's fine, but just individualise it a bit with the student. Weeks 4 to 5, they should definitely be practicing working out what the nutrition status is, nutrition diagnosis, potentially simple interventions. Week 6 to 9, they're building on those things, practicing their diet-disease relationships, delivering simple educations. And weeks 10 to 12, normally we would see some, we'd be expecting some time management skills, less supervision and exposure to complex cases. So, but that's all with the rider of everything else going on in their life isn't fitting a perfect line like that, which if they were with one supervisor for 12 weeks, they would progress a whole lot more. I mean, that's what we've just got to accept. It's a lot easier if you're just doing a similar caseload, similar supervisor. But in taking a holistic view, it's much better that they get exposure to more environments and more supervisors. They'll be that much more resilient and adaptable and work ready for whatever job they get. Any questions? Okay. MNT feedback. So the purpose of the feedback forms is to enable supervisors to spend once a week facilitating student learning through reflection. So you'll see that wording is very much not, it's the time for a supervisor to tell a student everything they've had problems with or everything they're doing well in one thing. It's actually all about helping the student to learn. And using that reflection, it's to gauge the student's insight into their own areas for development, because they're going to progress much more if they feel the need for it. So it also puts into place a minimum amount of time that a supervisor hopefully dedicates to really listening to the student about their learning goals. So once a week, we want to have some quality time with the students and the supervisors. Because during the week, supervisor might be quickly saying, yep, you're doing fine, or just that, just that. So this is a time to really stop and think. So when they start at external placement sites, you start at week 3, as we'll have had first 2 weeks completed at USC clinics. Likewise, when they start their second placement, it will be week 8, because they will have had 7 weeks before. So the feedback forms are located in the student placement feedback workbook, which I said before is sent electronically to the clinical educators who can pass that on to you. But the students also have a hard copy. So sometimes hard copies are really easy. You can just scribble on it while you're there. So there are different types of forms in there. The 2 main forms are the NCP process forms, which is actually commenting on each stage of the NCP process, from introduction to gathering information, to taking a diet history, to assessing and analysing, to working out some strategies and negotiating with the client, etc. So it's very much a logical format in terms of all the cues, and it's focused on the NCP process. Weeks 6 to 10, we've used the DA EPAs, which is a staged, understanding the stages of learning, and it breaks down steps into novice, beginner, advanced, beginner, and then pre-entry level. And we'll look at those forms later on. But it actually grades them. Even though it's not a formal assessment, they can actually see, with discussion with you, where they think they are in relation to where they've got to be at the end. Now, there's no point doing those forms every single week, because then you wouldn't see enough change. It's like if you did an SGA every day, there's no point in that. So we try to strategically sit them not in the last week of placement, but prior to the last week of placement at any one site, so that they've got time to improve in those areas, because it really is a good time when they're gathering their thoughts and your thoughts with where they're going. Then there's a small group education feedback form, case study feedback forms, and a copy of the final assessment rubric, which we'll talk about how we use that later, with examples of meeting or not meeting criteria. Just looking at the time, I'm very slow. I might have to speed up a bit. So MNT this is a student-led feedback. We utilise a student-led feedback cycle. So I just drew this diagram. So there's informal feedback that generally occurs daily, and that feeds into 2-way discussion and reflection that's always happening between the supervisor and the student. Then there's the weekly formal feedback. Then at the end of that feedback form, you'll always see 3 short goals with supervisors. So these are very short goals that they work on with their supervisor. Usually they're towards the end of the week, so that on the weekend they can flesh out those goals and really think about some purposeful strategies, and they have to submit them on their Pebble Pad, their SMART goals. Then ideally they should, if they can, is to go through those SMART goals with the supervisor on Monday. So what you want to be seeing is specific strategies. How are they going to help their learning process there? So it's a discussion. Prior to the feedback, so if you diarise or tell them at the start of the week when you're going to be doing the feedback forms with them, the student should the night before fill in a feedback form, or at some stage prior to the discussion, fill in the feedback form, come to you, and then you'd say, okay, what do you think with regards to this first section? And the students tell you, and then you use that to bounce from, you spring from there to confirm or discuss it further. This empowers the students. It lets them show you what they know, which is much more positive in their learning experience. If you're going to base a feedback form on an observation, please try to give the students 5 minutes or so break before they go into this, so that the introverts can have a bit of a think and they can have some downtime. I think it's just fairer that way. All right, if you can also allow some time so that it can be a discussion. I know you're all time poor, but it's a really important time in the students' week so that it can be a discussion and that there's some time to respond about comments. Your forms should guide you to cues and prompts, so they should make you think of everything you need to think of. Feedback forms, because of the amount of boxes and words in there and the amount of prompts, they can steer people to give actually too much feedback, in which case it might be hard for a student to prioritise what's the most important thing to focus on, because they can't focus on 10 things at once. So it's just a reminder, the good supervisors will try to focus on the main areas for development. And if you go through that form, you might say, look, this is something you can look at towards the end or later on. Right at the moment, from all this feedback, I think these are the most important things. So you don't focus on information about education in week 3, because really they shouldn't be focusing on that there. They should be focusing on gathering the information and taking basic diet histories. That just talks about progression develops from a targeted diet history to assessment and critical thinking to diet disease explanations, negotiations and time management. I just popped this in here in terms of ad hoc feedback during the week. These are some really useful tools that are used around some of our placement sites. Some use KISS, which is simply a student says, what should the supervisor prompts the student to ask them, what should you keep doing? What could you improve? What should you stop doing? What should you start doing? Then there's 2 positives or 2 negatives. So you're limiting the amount of feedback and you're starting with the positives. So you're getting them in a good frame of mind to cope with the things that they need to think constructively of. Now, we don't need to sandwich it, because we actually do want them to take on board the constructive feedback. Then there's the traditional ones, what went well, what didn't go so well, what would you do differently next time? Another one I've put in there that we tend to forget is, to what extent were you able to achieve the goals that you're working on? Because they should be in the foremost of their mind as they're going through in the week. We don't want to lose those goals that were just formulated once and then forgotten about. So that closing the loop is a good thing to remember. I'm going to skip over these. I'll just show you quickly an NCP form. So they start off with professional behaviour. So I've just highlighted some words in there that I thought were key. So fitting in with the team, respecting the supervisor, finding answers to questions before asking, but also asking for help when appropriate. We want them to show demonstrating diligence with improving knowledge and skills. Whoops, I'll go back, sorry about that. Then gathering information. You'll see in that highlighted thing, it's understanding the diagnosis and treatment. So I really don't want them to come to a supervisor if they haven't tried to understand what those things are. It's not just a matter of filling in the boxes. Likewise, taking note of biochemistry, but also understanding what it's telling them. Initiating the interview, where they often fall down, is clarifying the role of dietitian and the purpose of the interview. So already getting that hook to get the clients wanting to listen to them. So that they find that particularly difficult. Diet history, using a systematic approach. I expect all the students to use a pro forma. Now, inevitably, if they don't, they will have things all over the place and can't answer your questions and can't find information. So feel free to say you expect them to use a pro forma. Then it's correctly targeting relevant nutrients, adapting questioning and probing. Then it's assessing dietary intake. We expect they're going to check it against the 5 food groups as well as the nutrient of interest, and they don't tend to want to do that or like to do that, but like it should be standard. And then prioritising the data. In terms of communication and documentation, we're looking for a structured and logical sequence and responding appropriately to verbal and non-verbal cues, that tends to happen a bit later down the track. Responding to patient cues is a bit harder. Implementing the plan, so the diet-disease relationship, explaining why foods, how foods link to the disease, working on realistic goals and looking at barriers to change, which is sort of something they find hard. And then summarising at the end of the session with the client. So that form's quite different to the skill development feedback form, which is what we use in week 6 and week 10. So this is what it looks like in a summarised form. So we have assessment criteria on the left. Then we have novice, so it's where they're assisting in activities with direct supervision, to advanced beginner, where they're progressing, providing where they still need direct oversight and frequent supervision, and entry level, which is that where they need occasional or oversighting supervision. So when we assess them, we'll be looking at those entry level skills on the rubric. So I'll just read through the first one so that you can see the sequence of how it hopefully works logically with you. So a novice, in terms of facilitating optimal food choice, a novice might use a pre-formulated plan or template to tell the client changes. Then that subtly changes to an advanced beginner who's attempting to involve the client but may not recognise when the client needs help. To entry level, where they're using client-centred counselling skills to negotiate appropriate nutrition care plan. If we look at communicates appropriately, the novice might be unable to explain concepts about diet or disease or reasons why the client needs to make that change, that linking. To advanced beginner, their explanations may be formulaic. They say the same thing to everybody. And they may have difficulty responding to patient questions, simplifying their information, or adding depth. It's that individualising. And then entry level is translating technical information into practical advice about diet and disease. So hopefully you can see examples of progression in there. And they just continue through safe practice. So safe practice, a novice not aware when needs to seek support or when needs help to plan an intervention. So they might be, you know, if they're sitting there 3 hours with a chart and they're just reading a novel rather than targeting their information gathering. Effective, that takes time to gather information, formulate and implement a plan. Often that's because they don't know what they're doing. So it's a good sign if they're really, really slow, they just don't know. We've put in a few minute values in here just to put them in. So increasing, so under that effective and advanced beginner in the middle box, we've got increasing skills, finding information and developing a plan. So being very generous in that middle box, improved time management required. For example, 90 minutes to gather basic info, 60 minutes for diet history, and 60 minutes to write up, just to have something written there so that they're starting to think of timing. And then for entry level, completing tasks in an acceptable time frame, for example, 1.5 to 2 hours. And you know, that's where it depends on how complex the client is, but they need to know about times, that does matter. I'm going to go from there. I'm just looking at the time, 12:54. So I've just put in a couple of things there that how we've taught students about the importance of feedback and how they should be accepting feedback. And some things that you might be interested in was, at the top, supervisors might be good dietitians, but it doesn't mean that they're necessarily comfortable giving feedback. I don't think dietitians on the whole are comfortable giving constructive feedback. They may not acknowledge what you're doing well, might be the other side of the coin. They might give too much feedback, and they might avoid bringing up some things that are a problem. And there might be a reason for that. We'll talk about that later, but either way, we try to tell students, always thank your supervisors and be genuine. Say that you'll think about the feedback and try to work out ways to improve, and then it's up to you to work out on strategies and get back to the supervisor. We also have to remind students to accept that they're not perfect. We have so many who are perfectionists, and it's a real hindrance. And they can take it really to heart if they're not being perfect. So they've got to accept that they're not perfect, that they are a student, that they're there to learn. And you can, supervisors can encourage to a certain extent, but also you do need to be able to give them advice to help them improve, because some students are a little bit, find it hard to get constructive feedback, but part of their resilience and emotional intelligence that we assess them on is that they've got to be able to accept constructive feedback as well. So finally, looking at the medical nutrition therapy final assessment, there's 3 components to it. We have a meeting over the phone with the supervisor, the student and myself, where I obtain feedback from the student and the current supervisor, and I take this into account along with artefacts such as the feedback forms, the Pebble Pad, Code of Conduct, participation in Friday tutorials, telephone conversations. So I'm really getting lots of information from my end about how they're going. The university makes the final determination, and that's not just, doesn't just sit with me. We have a moderation process, so we talk with our peers to ensure that our decisions are valid. Students are notified of their grades when USC is told, and we do not go back and tell sites about their grades because that would be a breach of confidentiality. Student code of conduct, so their professionalism, confidentiality, all that stuff sits under the student code of conduct, and that doesn't get signed off until the end of semester, because that would include any emails or follow-up emails, even to us if they weren't happy about something. They always have to be abiding by that code of conduct. And their Pebble Pad is due on their final day of placement. So if they're looking a bit rushed on the Friday, that's why. Students, as students do, leave things to the last minute. But the reason we do that is because quite often they're going to be at a new placement on the Monday. So it's in their best interest. We want them to be able to have the weekend to gather their thoughts and get ready for their next placement. So the final assessment occurs in a half-hour time slot. They're the time slots that students work with their supervisors to have a phone call. I take the notes and no other forms required in that week. The supervisor and the student review the assessment form individually and don't discuss it prior. So at the meeting, the student and supervisor are together on a speakerphone and I'm on the other side. I give a bit of a précis to where we're going. Then I ask the student whether they feel they meet the criteria. It's one question about all the criteria. I've checked that they've read the criteria. Do they feel they meet the criteria? Then I ask them to provide a summary of a case they've managed recently. And so I expect them to tell me about that case as they would to a supervisor if they were managing a client. So 86-year-old male who was admitted with and was referred to the dietetic department for this, biochem, NAD, to tell me the whole story. Then I ask the supervisor present to confirm the student account because I haven't been there, it needs to be validated. Then I ask the student whether they feel the student meets criteria, and that pretty much finishes the final assessment. So it's very, very, there's no stress involved there because it's all happened. And if there were any concerns, we would have looked at them earlier, managed them earlier, and the student would know where things were heading. So it's really no surprises because all the information's there and there would have been early intervention. So yeah, any problems or concerns about students, please let me know. Sooner is better than later. So what we're looking for essentially is for students to consistently manage basic or familiar cases safely and independently within a reasonable time frame and with minimal supervision. Now this is just, I'm throwing this up, this is an example of the rubric. And as you'll see, we don't have the 3 columns anymore of novice to advanced, beginner to entry level. We just have examples of standards met and standards not met. And though the wording used there is very similar to the wording you've been seeing on the feedback forms before, so there should be nothing that doesn't look familiar. It is quite a long form, but once again, we don't read that all through in the assessment process. So if you have any issues at all, please contact me at any time, whether they're code of conduct issues, whether you're not sure about something or a little bit uncomfortable about something, their professionalism, including uniform, any student health concerns, confidentiality. If students are just requiring too much of your time because they can't do self-directed or they seem to not know what to do. Oh, I didn't finish off the sentence there. Students not seeming to be. Don't know what that means. So that's what I wanted to cover, and I noticed the time, but I'd love to have any questions or comments. Anything? No. All right, well, I'll leave it there. Please contact me at any time. And thank you so much. I should have said this at the start. Thank you so much for all your support of our students. We're very lucky with supervisors we have. They're always caring and definitely have the students' interest at heart. And I really appreciate supervisors letting me know early if there are issues, because most of our students are very conscientious, and once they know there's an issue, they'll try their hardest to fix it. So it's best to let them know of little things up the front, and if things aren't improving, to let me know as well. Well, thank you very much, everybody. Have a great day, and we'll see you over time.
Thanks, Tanya.
Thank you.
Thank you. Goodbye.
Bye.
Thank you.
Thank you.